Hi, I'm Robert, and this skills video is going to deal with bag valve masks and respirations. The normal respiration rate for an adult is 12 to 20. If the rate is below 8 or above 24, the person is no longer getting adequate oxygen to survive. At those points, we use something called a bag valve mask. On high respirations at 24, there are other things that can elevate respiration, so you have to use your judgment and look. But above 30, people are no longer effectively breathing because they're inhaling and exhaling so fast that the tidal volume never gets in. So below 8 and above 30, you always use a bag valve mask. And from 24 to 30, you look at the person's color to determine whether they're getting adequate oxygen or not. Bag valve mask consists of two basic parts. A mask, which will go over the patient's face and provide a seal over both the nose and the mouth. And a bag, which allows you to move air in and out. There always is some provision for attaching oxygen. So if you have oxygen available and you have a bag valve mask, you will put oxygen in, you will put the flow rate at 15, just like high flow for a non-rebreather mask. So the trick on using a bag valve mask is you want to create a good seal. The natural tendency is to push down. When you push down, you compress the patient's airway and you can't do it. So what you always want to do is pull the patient up towards the mask. For normal two-person bagging, one person will hold the mask on by putting their thumbs up at the top and pulling with their fingers underneath the jaw up into the mask, and then the other person will provide the bagging. For a single person, you'd have to do this with one hand, and again, it's quite easily done. You can put your fingers under and grab the jawbone, tilt the head back, and provide pulses. Bag valve rate is right at 12 per minute, so that's 5 seconds. You're supposed to do 3 seconds of 1, 2, 3, and then 1, 2. I went too fast there. 1, 2, 3, 1, 2. When you're doing this, you should see the chest rising. The point of volume that you put in is when you've seen the chest rise, then you stop. You have to be aware that if you go too fast, you might make it go into the gastric area, which would cause air to go in the stomach, which is called gastric distension. So that's something associated with going too fast or going with too much volume. But in general, it's 1, 2, 3, 1, 2. 1, 2, 3, 1, 2. For pediatrics, there should be a smaller mask. If you don't have one, there is a trick where you can just flip the mask over and kind of go across the whole face, and this will handle a child. Remember, with a child, they don't take anywhere near as much. Again, it's the same rate, but you won't use the full amount. Is there anything else I forgot, Jody?
I don't think so.
Okay, thank you.
Yeah. Shouldn't be that hard. Here, Robert.